All right. Hello, everyone, and welcome to iVET360's first town hall webinar on COVID-19. My name is Kyle Van Kuchen. I'm one of the HR and training managers here at iVET360, and I'll be taking you through this presentation. Before we begin, I do want to go over a couple items. In regards to the Q&A portion, we literally received hundreds of questions regarding COVID-19. We know you have a ton of questions. I'm going to go over as many as I can during this presentation. I still highly encourage you to keep submitting your questions to our COVID-19 resource website, and I'll also go over another avenue for you to reach out to us here at the end of the presentation. Also, as I'm sure all of you have witnessed with the high traffic in regards to streaming platforms, Zoom, GoToWebinar as well, there has been some stress on those systems, so please bear with us. If you have any sort of technical difficulty, reach out in the chat box and we'll do our best to troubleshoot. Also, we will be going over policies that, over the course of this week, I think I've had to update this specific presentation about 6 or 7 times, just because as the government comes out and they give us more information, we're having to update. So again, please make sure you're taking a look at the Department of Labor website as well as our own COVID-19 website. We're going to ensure as soon as it gets posted to the Department of Labor, we get it up on our end as soon as possible. Most importantly, on behalf of the team here at iVET360, I want you all to know that you're not alone. We know that there's a lot of ambiguity around what is going to be coming. We know that there is a lot of concerns on your end, and we're doing everything we can to provide free resources to you out there who are keeping your doors open and ultimately are the heroes in all of this. We know it's not as easy as just shutting your doors and weathering the storm. And we know that you all are here today because you're trying to help your staff, you're trying to help your clients, and you're trying to help your community. So please, on behalf of all of us, thank you for keeping your doors open. Now allow us to light the way for you. Let's go ahead and dive in. All right, so today we're going to be going over HR 6201 and what it means for you. That is regarding the Families First Coronavirus Response Act. For the sake of everyone's time, I'm going to shorten that down to the FFCRA. You'll hear me calling it that. We will also be discussing taking employee temperatures. Now, any of my fellow HR colleagues out there, all of us just kind of had our heads roll off our shoulders, but yes, this is something you as an employer can do, and we're going to go over that in our PowerPoint here. We'll also be going over some of our best practices to ensure you can keep your doors open and as best you can keep your staff and your clients healthy. And then the moment you all have been waiting for, a little bit Q&A time here with me, Kyle. First up, so FFCRA, Families First Coronavirus Response Act. What is it? So this was a law that was signed in on March 18th and is a comprehensive relief bill aimed at softening the financial fallout of COVID-19 on families across the United States. Now, everyone is wondering, okay, who exactly does this apply to? If you employ less than 500 employees, meaning 1 to 499, this applies to you. This goes into effect on April 1st and sunsets at the end of the year on December 31st. All right, so what does this mean for your practice? I think the easiest way to really break it down and explain it is to split it into 3 parts. We're going to have to bounce back and forth between some of these slides just so I can make sure you see the information. Some of these slides are a little content heavy. I do apologize, but I'm going to do my best to walk you all the way through it. So let's dive in. Oh, also, I want to make sure we're clear too. This is going to be a high-level overview, and we're going to be posting all documentation that you see or we discuss today on our COVID sites, covid19.ivet360.com. Please ensure you jump back to that website after this presentation to gather any information that is discussed today. All right, part 1, emergency family leave or expanded FMLA. This applies to employees that have been employed for at least 30 days who can't work because of their child's school or childcare was closed due to COVID-19. Also, you're probably wondering, okay, well, what classifies someone as a child? Right now, they're saying that is anybody who is under the age of 18. Yes, this is paid, but there are a couple pieces to this. So the first portion of that leave, the first 10 days, are going to be unpaid. Your employees are able, if they elect to, use any PTO or vacation that they have on their end, but they are not required to do so, and we'll go over that here in a couple slides. After those initial 10 days, those employees would be eligible for at least 2/3 of their regular rate of pay based on the number of hours they would have otherwise been scheduled to work over a period of 12 weeks. So it works similar to the traditional FMLA where they're covered for 12 weeks. But again, this is specifically addressing the child care portion where they would get paid for 2/3 of their normal rate. Part 2, emergency paid sick leave. This is where it starts to get a little content heavy. So if you haven't grabbed a seat, go ahead and get comfortable. I'm gonna have to go back and forth between a couple slides to make sure I get all the information out here. All right, so this applies to all employees, regardless of how long they have worked for you, if they cannot work for COVID-19. Your full-timers will get up to 80 hours of paid leave, and your part-timers are gonna be entitled to paid sick leave based on the number of hours they work on average over a 2-week period. So how do they get qualified for this leave? There are 6 qualifying events as they are known now. They may further outline this again over the days to come, so please make sure you're staying tuned into the Department of Labor website. So part 1, the employee is subject to a federal, state, or local quarantine or isolation order related to COVID-19. Most of you sitting in this audience right now are probably under some form of a quarantine related to COVID-19, but this portion, as we understand it, only applies to non-essential businesses, so this should not apply to veterinary facilities within your state. Part 2, employee has been advised by a healthcare provider to self-quarantine due to concerns related to COVID-19. We believe this is specifically targeting those employees that may have an autoimmune disorder or an illness that could be exacerbated by COVID-19. And this next one, number 3, is probably going to be the most common issue that you're going to address in regards to the FFCRA. So the employee is experiencing symptoms of COVID-19 and seeking a medical diagnosis. So right now we're in the middle of allergy season, we're in the middle of flu season, and there are any number of illnesses still out there right now. So the key is an employee cannot come to you and say, hey, Kyle, I'm not coming in because I have a sore throat or I have a cough. They're allowed to not come in, that's fine, but they need to have some form of note from a doctor right now saying, hey, we are seeking a medical diagnosis. The reason why it's seeking a medical diagnosis, as I'm sure we're all aware, is that it's not exactly as easy as walking up and getting tested right now. So we want to ensure that they have some form of documentation. Part 4, the employee is caring for an individual who is subject to either number 1 or number 2 above. Number 5, this is another one I want to go over here. So the employee is caring for their child due to COVID closures. Okay, so that sounds very similar to the expanded FMLA. Can they use both? Yes. So how it would work is they could use the emergency sick leave portion to cover that first 2 weeks of FMLA, or rather expanded FMLA. And at that point, the expanded FMLA would take over for the 2/3 of their rate for the remaining 10 weeks. Number 6, the employee is experiencing any other substantially similar condition specified by the Secretary of Health and Human Services. This is the government catch-all of if we decide there are more symptoms or a medical professional decides that this is related to COVID, they would qualify. I know it's very vague, but I think it's kind of their catch-all to ensure that they're not discriminating against anybody that may have symptoms. All right, so what are the pay requirements? So this, again, I'm going to throw a little bit of a wrench at you here. So depending on the reason that they're leaving, they will qualify for 2 different rates of pay. So part 1, paid sick leave must be paid at the employee's regular rate of pay or minimum wage, whichever is greater, for any leave taken for reasons 1 through 3. So I'm going to jump back to this previous slide here. I'm going to give you guys to take a second to look at this. Again, please do not feel as though you have to write down all this information. We are going to be ensuring that this is posted to our website. So again, just take a look, we'll post it for you. So again, 1 through 3. Part 2, an employee is taking leave for reasons 4 through 6 may be compensated at 2/3 of their regular rate or minimum wage, whichever is greater. I'll go ahead and jump back one more time here. Again, any of those reasons 4 through 6, they're getting 2/3 of their rate of pay. Now here's the big one. Can you, the employer, require them to use any PTO they may have before they are eligible? The answer is no. You cannot require them. They're allowed to use it, but you cannot require them to use it. And then part 3. So I'm going to tell you right now, there are plenty of rumors and speculation and vague semi-answers as far as how exactly you, the employer, are going to get your money back. But at the end of the day, the one thing that has been made almost abundantly clear is that this is going to amount to a one-to-one reimbursement to you, the employer, for any dollar amount paid to the employee through parts 1 and 2 regarding emergency paid leave, as well as that expanded FMLA. It looks like it's going to come out as far as a tax credit, the 6.2% of the Social Security tax part. I would highly encourage you to reach out to your payroll provider right now and see if they have any guidelines for you. I'm not going to mention any specific companies, but some companies, per some of the clients I've talked to, have already given out guidelines or already have a policy or a procedure in place. So you may be able to get ahead of the power curve here. All right, so now we've addressed kind of the big portions of this FFCRA, and I'm sure as a small business you're going, great, like how do I pay for this? How do I ensure the staff's safe? And ultimately, the best way to minimize your risk of needing to utilize this is keeping everyone as safe and healthy as possible. So I want to dive into some best practices that you could put into place to help, again, keep your staff healthy, your clients healthy, and ultimately your community healthy. Again, all my fellow HR professionals in the audience, please hold on to your seats. So if you told me 2 months ago that I would be advising almost 300 people that they would be able to take their temperatures, their employees' temperatures, my head might have rolled off my shoulders. But the EEOC has clarified as of March 18th that you as an employer are able to go in and take an employee's temperature to confirm that they are not symptomatic of COVID-19, but this comes with a couple pieces here. So it has to be consistent, can't target people. And I want to outline some of the best practices around what you should be doing if you decide to go this route. Not mandatory. Again, these are just best practices if you choose to do it. So step 1, you want to figure out who exactly is going to be the personnel that's conducting these temperature checks. As far as my suggestion, I would say someone from your leadership team who you can ensure is going to be responsible and take this seriously as they're taking the temperatures. Training. This may seem like common sense, but this is not the time to make any sort of assumptions. So ensure that that designated employee understands how to safely check a temperature, utilizing appropriate PPE. Now, all of you right now are saying, okay, well, we're not supposed to use PPE or conserve the use of PPE per the AVMA. This is one of those situations where if you're going to be checking someone else's temperature, use a glove. You do not want to risk any sort of cross-contamination. Equipment. I know all of you right now probably have an abundance of thermometers in your clinic. For many reasons, I would not advise using those specific thermometers. So if you can reach out to whoever your local store is and get an infrared digital thermometer, that would be my best advice, ensuring that you're sanitizing it after every use. Or if you can get each employee their own digital thermometer, they can take their temperature in front of you and show it to you, that's another option. But again, we want to minimize as much contact as possible. And the last piece here, and definitely not the least piece here, is going to be confidentiality. So what you don't want to happen is a line of employees lining up outside your building and everyone looking over each other's shoulder, checking each other's temperature. For all intents and purposes, this is a direct confidential meeting between you and your employee. No information should be shared in either direction, period. So again, that's why we're making sure we have one person from leadership, because what you don't want is, you know, I take someone's temperature and then I go out on the treatment floor and say, hey, guess what? Kyle's got a temperature of 104. That cannot happen. Please, confidentiality is key. All right, so here's the big what if. What if an employee has a temperature? You are able to send them home on a 14-day quarantine. However, I would recommend that you pay the employee for the day just since they've showed up for work. Now, some states, this doesn't matter. You have to pay the employee if they show up for work that day and you choose to send them home. So again, please check with your state guidelines. This may not directly apply to you, but as a general good faith practice, if they come in, they're trying to show up and you have to send them home because of COVID, at least for that initial day, pay them. And as always, again, going back to confidentiality, you do not want to share any of this information to the team. You do not need to tell anybody on the team that any specific person has symptoms. All you need to say is, okay, we had somebody that needed to go home, and that's it, we're moving on. All right, so that's kind of phase one of best practices. Now I want to jump into some specifics that you could do from two different levels, whether that be with your actual staff team themselves, as well as how you can help your clients, even if it's not direct safety, the perception of safety and showing them the procedures that you've put in place. All right, so some best practices for in-clinic for your clients. One thing I've seen quite a few businesses, not just veterinary facilities, but even the grocery stores, they're measuring out 6 feet of space and placing a tape box for clients or customers to stand in. Right here, obviously it's not airtight. It doesn't guarantee that somebody's not going to get sick. But if you're showing your clients that, hey, I'm taking the extra step and I'm trying my best to try and keep you safe, I'm minding social distancing, it's a step in the right direction. But ultimately, what you want to try and do is minimize the amount of clients in your building at any one time. I know a lot of the mainstays of our business is being able to interact with the client. I understand, and it pains me to say this, but right now, this is not the time to have the whole family in the building. As best you can keep up with them and try and communicate with them, whether that's through telemedicine or through the phone. But ultimately, the best course of action, if you can, is transition to some sort of hands-free, contact-free appointment, even if it's just a minimal interaction where you're transitioning custody of the animal. If you do choose to have them in the hospital, I would recommend ensuring that all of your treatment plan items are done in the back. Again, we do not want to be staying in the same exam room confined with someone who you can't confirm whether or not they do or don't have symptoms. So if you can get out of that confined space, that's a start. It's a step in the right direction. This next one, make sure you're careful with for many reasons. So if you have stock and you're able to do it, you could set up some hand sanitizer stations around the clinic. I know all of us have seen different situations where people have come in and take these out of the facility, or potentially somebody's using more than they should. So obviously use your best judgment on where you place these. The best course of action really comes down to placing arrows showing clients where the nearest hand washing station is. Even if it's just the bathroom that's been there for the last 20 years, point them in the right direction. Again, it's just giving them a visual, pointing them to where they need to go. But again, and I've mentioned this multiple times, hands-free. So whether that's contactless payments using mobile pay or telephone pay, telemedicine if it's an option for your facility. And specifically talking about telemedicine, I know that there are quite a few different companies right now that are offering either free periods of their telemedicine applications, or they're offering reduced rates because of what's going on with COVID-19. So I would check with your suppliers, I would check with your own colleagues within your community and see what's applicable within your area and see if you can potentially get a deal. But of course, again, make sure you read the fine print. You don't want to get locked into something long-term if that's not your goal. All right, best practices for your staff. So ultimately right now, what I'm seeing through quite a few questions is that it seems as though people want to lead this charge with a policy. This is not the time to lead with policies. You want to have a policy in place, but your team is looking to you to be a leader. And we're going to go over that here in a second. But again, so as far as things you can do inside the clinic, hand washing. So anytime somebody enters or exits a room, have them wash their hands. After deep cleaning, consider a visible indicator that the room is ready to be used again. So everyone's used to, okay, that exam room looks clean. This is just a physical marker that, hey, we have gone in, we cleaned, we disinfected, and now a client can now enter here safely. One of the biggest things you can do, and I would highly advise all of you at least put pen to paper and try to write this down, would be splitting your entire team into two teams, whether that's A, B, or A, B, and C, because what it'll allow you to do is, so let's say I'm on team A, right? And I come down symptomatic, or worst case scenario, I come back positive. At that point, all of team A has potentially been exposed, but you'll still have team B, C, D ready to step in. Obviously, you want to make sure that you're informing clients that have had an interaction with them. You want to inform other staff if they're positive for COVID-19. We're not talking about every symptom for any number of reasons. Again, this could just be the flu. We don't want to raise the alarm over something that's not confirmed positive COVID-19, but you do have the ability, if one person gets sick on team A, to send the whole team home. You're not required to do so, but you have the ability to do so. And one of the biggest things you can do right now is inventory conservation. So we all have that one technician, I'm sure, who likes to take a bundle of paper towels and clean the same square foot of exam table. Those days are done. Use the amount of supplies that you need to use to accomplish the mission. We do not need to be using excess right now. And another thing to consider, and this is really going to depend on how your facility is laid out, is if you can lock down specific areas of the hospital that are not going to be used, that might be a good course of action as well. So instead of using all 6 of your exam rooms, if you can lock it down to just 2 exam rooms, that's at least 4 exam rooms you don't have to clean, at least the inside. Of course, you want to clean the outside because of how things are transmitted. All right, so now the time you all have been waiting for, a little bit of Q&A time with me. So we're going to go through a few of the questions that were submitted from the applications themselves, and then we'll try and address as many as we can after this presentation as well. I'm going to have more information in another link that you can follow to submit those questions, but without further ado, let's jump in. All right, question 1 is from a hospital in Texas. I'm encouraging staff that do not feel safe at work to not come in. Good. We are not allowing clients in the clinic, and we are doing curbside service where the technicians are getting the pets from the car. Good. Most have PTO accrued that they can use. Are there good resources for staff that don't want to work due to health risks or fear? And what are my obligations to them? So again, going back to what I said earlier, your team is looking for someone to give them direction. They're not looking for a policy to be instituted. Now, I'm not saying don't adjust your procedures based on what you need to do things safely, but as best you can, engage those soft leadership skills. So start checking in with your team. Do as best you can to make them feel safe. Reassure them. You know, right now, this is the most appropriate time to say, honestly, I don't know what tomorrow is going to bring, but here's what I'm going to do today to ensure you're safe. That is going to get you much further than, well, please check page 19 of our employee handbook. They don't need that right now. But specifically, as far as specifics that you can do for that employee, look into your insurance provider and see if they have an employee assistance program. Maybe not the most ideal solution, but most of them have some form of crisis counselor or some sort of service somebody can call into if they're really concerned about any aspect of their life. And maybe that might help. And then again, under the FFCRA, if the employee receives a doctor note, they are able to take advantage of the emergency sick leave portion. So they're not handicapped, they just need to go to the doctor and get a note. That's really all it comes down to. Just get a note and then you'll get an accommodation. Next question, hospital in Oregon. Can an employee who says they had coronavirus symptoms but didn't get a test apply for benefits? How do I document this if I withhold money from my quarterlies? Great question. So again, in order to qualify for the emergency sick leave, an employee must be experiencing symptoms and seeking a medical diagnosis. They have to be going to a doctor and at least getting something in writing saying, hey, this is serious. I'm actually going to be, pursuing some form of diagnosis as it pertains to COVID-19. Over the next few days, we are anticipating that the Department of Labor will be outlining how to properly document the employee use, but your best course of action right now is to dive in, start documenting, make a spreadsheet, and if anybody's going to be out or starting to experience symptoms and they're starting to miss time, write it down, because the one piece here is that the emergency sick leave portion will be backdated to March 1st. I know I threw a wrench at you. So if, as of April 1st, if you have anybody in March that was out or took leave in March because of this COVID, so if you sent them home on a quarantine, if they didn't come in because of it, anything like that, it still applies where they need a note, but technically they would be covered as of March 1st. Still comes down to that doctor's note. They got to provide documentation. And then, as always, again, keep your eyes peeled on the Department of Labor website. And I know that everyone on the HR team here, as well as everyone else on the team, we've been kind of information hawks. So as soon as information pops out, we're getting it up on our own COVID site. So either one, again, we're going to try and get things out as quickly as possible. Question 3, hospital in Florida. New Emergency Paid Sick Leave Act and new FMLA additions. We are less than 25 employees and need to know how to respond if we are exempt from one or both. Information that is floating around in the media and other sources is so confusing. Let me tell you, there has never been a more true statement said. We agree. It is confusing, but again, that's why we're here. Please tune into our website and take a look. We're going to do our best to answer every question, but specifically for this question, again, over the next few days, Department of Labor will be outlining how to apply for this exemption. It sounds as though right now you will need to provide some form of documentation showing that the long-term financial health of your business is going to be impacted by using this act. I don't foresee that being hard to prove, but again, they haven't necessarily outlined a criteria as far as what you got to fill out or what you have to prove. Question 4, hospital in Illinois. How do these new laws that are effective April 1st affect a business with 12 employees? So again, any employer that is employing less than 500 employees, so 1 to 499, the FFCRA will apply to you. But if you're worried that this will affect the long-term financial health of your business, as we just discussed, keep an eye out for how that exemption process is going to work. The other news, and again, this is less than confirmed. We've all heard the news that they're going to be throwing money at people, but here's our understanding as far as federal relief. Right now, if you are doing everything you can as an employer to ensure that you are maintaining your headcount, that you're not doing a reduction in force, that you're not doing mass layoffs, that seems to be the guidelines as far as whether or not you're going to be receiving money and whether or not those loans may or may not be forgiven. So again, if you're concerned right now and you're sitting in the audience and you're thinking, great, I have no option but to go back to my team right now and let everyone go, I challenge you to please reach out to us so we can try and work with you to figure out if there truly is another solution. If you are thinking to yourself, well, I've tried A, B, and C, and D is just too much work, please reach out to us. That is what we do for a living, is try and make this more manageable. So please reach out to us. Let us help you help your employees. Question 5, hospital in Mississippi. I have not been directly affected at this time with my employees, but they did have travel and potential exposure to coronavirus weeks ago. I am struggling to make the right decisions about requiring self-quarantine. What are ways I can keep all of my employees if business does decrease significantly? And how does the Government Emergency Act assist businesses with 10 employees or less? So before I go into this, unfortunately, hospital in Mississippi, this first solution does not apply to you, but by and large, there are many states where this does, so I want to go over this. Work share programs are probably the best case scenario as far as retaining staff and reducing cost. And how they work is essentially they're a light furlough. You're able to say, okay, I need to cut 40 hours across the board and I have 4 employees. You could, instead of removing 1 full-time employee, you could cut 10 hours from each employee. They can apply for unemployment insurance for those 10 hours they missed. They still retain their job. You still retain that employee. They still retain their benefits. So that's kind of like the best case scenario if that's where we're going to go for a reduction in force. The other option, again, it's not the best outcome, but at least it's not a permanent outcome, would be a furlough. How this works is truly the traditional, temporary layoff. I know that's been thrown around a lot. As for all intents and purposes, furloughs should be considered your temporary layoff because these are where you're going to be outlining when that layoff ends or when that furlough ends, and then you can bring that employee back. You're able to re-furlough them if you need to, but at least it puts a start and end date on when their employment has been paused, and they still retain their medical benefits, and they can still apply for unemployment insurance. So again, it's not the greatest option, but you're not losing that employee, and you're still showing good faith as an employer saying, hey, we want to keep you. We just, unfortunately, because of these major circumstances, are unable to keep you on staff. Question 6, another hospital in Illinois. Do we continue to pay hourly employees that have elected to not work due to their health concerns, such as someone with an autoimmune disease? So no, you are not required to pay employees who have elected to not work. They need to meet the criteria in the FFCRA, meaning they have to go get a doctor's note. Okay, that's really all this comes down to for a majority of this. If you are concerned and you have a reasonable concern, then please go get a doctor's note. So again, for specifically those employees who are autoimmune disease, we're looking at the portion of the emergency paid sick leave that says the employee has been advised by healthcare provider to self-quarantine due to concerns related to COVID-19. Another hospital in Illinois. If we end up laying off hourly employees, do they file for unemployment? Or do we pay them the hours that they would have worked? Does this new bill take this into consideration? So let's dive into this. Yes, they would get paid, but it's through their normal unemployment process. So if you have to terminate someone and they apply, you don't automatically pay for their unemployment benefits. It just, again, it goes directly through your state's unemployment process. I would advise everyone at the bare minimum to give this the weekend to see what the Department of Labor comes up with, because it looks like, again, they're going to be throwing money at employers that are able to retain employees. So that's our goal. We just want to, as best we can, just look for these guidelines before we make any decisions. And that is the main portion of our presentation today. Thank you so much for attending our town hall. Our next town hall is scheduled for Thursday, April 2nd, where Heather Romano will be leading that webinar, which will include information about the stimulus package that I had alluded to, any updates to processes related to the FFCRA, and answering as many questions as possible that we did not get to today. If you do have more questions, you can also go and sign up for our HR COVID support, which offers you unlimited access to our HR team, and then we'll go ahead and answer any questions you may have. But in order to access that, you're going to go to, and please take note of this here on the screen, iVET360.com/HR. Even if you reach out to our main resource site, we'll redirect you to where you need to go. But again, that's how you can get further support. And again, I want to make sure that we're all clear. What we do now as employers is going to echo through the halls of history. So please ensure that you're doing everything you can to help your employees and help your staff. If you're caught in a position where you feel, heck, I don't know what to do now, reach out to us. If you're worried that you have no other options, reach out to us. And it may be true, maybe there are no other options, but at least allow us to say, hey, it does look like you haven't, tried everything. Let's try this approach. Or hey, you've exhausted all the tools. Let's, unfortunately, you're left with the hard decision. But again, my name is Kyle. Please reach out to us via COVID-19.iVET360.com, and we will hopefully see all of you April 2nd at 10 a.m. Thank you.